MediShield Life premiums will remain the same for the first 5 years. Health Minister Gan Kim Yong gave this assurance on the new universal health insurance scheme a day after the MediShield Life Review Committee unveiled its recommendations. Now, he also said the standardised integrated shield plan for Class B1 wards will likely start along with the MediShield Life at the end of next year, 2015. Sarah Gross has more.
The Health Minister said premiums for MediShield Life will hold over the next 5 years after taking into account likely cost increases.
We will hold it for as long as we can, and we have already taken into account the projected cost increase over the next 5 years in deciding the premium. We cannot preclude catastrophic changes to the healthcare landscape. What that is, hard to predict. But all things being equal, based on our projection, we do not have intention to vary the premiums.
To ensure premiums are affordable, 2/3 of all Singaporean households will be eligible for subsidies. Larger families will receive more premium subsidies. The Health Minister said this is to help cushion the financial commitments that they face.
For those with older parents, especially those parents who are not pioneer generation, and the young kids or large families, their financial burden will be heavier, and therefore we take that into account, and that is why the subsidy structure is based on per capita income, depending on the number of people in the family.
While MediShield Life will provide better benefits, there are concerns that health costs will increase among service providers. Mr Gan said efforts will be stepped up in claims experience monitoring. On the proposed standard integrated shield plan covering Class B1 wards, the Health Minister said there should not be large variations in premiums between private insurers.
I would imagine that the differences between the service providers ought not to be very large, because the basic features of the B1 plan will be the same.
The MediShield Life Review Committee also recommended that the CPF Board and the Health Ministry publish more information on the MediShield Life Fund. Mr Gan said that his Health Ministry will look into how they can provide more financial information to the public, such as how the fund works and what the relationship is between the integrated shield plans and MediShield Life.
Still on MediShield Life, the head of the Government Parliamentary Committee for Health has welcomed the premiums that were recently announced for the scheme, saying they were lower than what some had expected. But he says subsidies can be further enhanced for other vulnerable groups of people. Sarah again with this report.
Keeping MediShield Life premiums affordable has been the key concern among Singaporeans. And now that details of premiums have been released, the GPC chairman for Health said the initial feedback gathered is that the premiums are at a reasonable amount. While he welcomed the range of subsidies to help Singaporeans with their premiums, he said there should be a subsidy scheme in place for those who go through an unexpected period of difficulty, such as a sudden illness or job loss.
One simple mechanism would be just to maintain the degree of subsidies. You know, it's a decreasing subsidy, 80, 60, 40 and so on. The ministry can decide to maintain the 80% subsidies, not over the 4 or 5 years instead of just for the first year.
Some Singaporeans Channel News Asia spoke to also felt that subsidies for premiums could be improved, but in general were happy about the benefits provided.
I prefer the subsidies be individual rather than be the per capita household. Is because that for individual the power of earning is different per person.
I find that it helps in certain area. People like my parents, because they are at their age of 70s, so it helps.
MediShield Life will offer enhanced benefits, and that may mean that private insurers have to be more competitive.
If the bar has been raised by MediShield Life, and if they don't keep up with the game, then obviously more Singaporeans may just think, look, the basic or the level of care given to me by MediShield Life is probably enough.
Dr. Chia added that the proposed standardised integrated shield plan for Class B1 wards will give policyholders more choice without being excessively burdened by cost.
Palliative care, which focuses on relieving the suffering of patients, gets a boost with plans to enhance services and improve infrastructure. There'll be more hospice beds, funding for service providers and training for medical professionals. Patients will also be able to draw more from their MediSave accounts to pay for such services. Health Minister Gan Kim Yong announced these measures at the opening of the Singapore Palliative Care Conference this morning. This report from Eileen Poh.
The Health Ministry is putting in more measures to ensure Singaporeans nearing the end of their lives are well cared for. They include ramping up home care palliative services by at least 1,000 more places by 2020. There'll also be more beds set aside in community hospitals for patients on palliative care. Currently, only one community hospital here caters to patients on palliative care, and the number of inpatient palliative care beds will double by 2020.
Palliative care has become more important today in the context of our rapidly aging population. We need to invest in developing palliative care, as this is a critical piece in our overall efforts to provide good and affordable care to help patients age and die in place.
There are also measures to ensure that those requiring palliative care will pay less cash for their medical expenses. Patients can now withdraw up to $160 a day from their MediSave accounts for their stay in inpatient hospices. In January 1st next year, the limit will be increased to $200. The lifetime withdrawal limit will be raised for those requiring home palliative care services from $1,500 to $2,500, and there will be no cap for those with terminal illnesses such as cancer and end-stage organ failure. To ensure the industry has sufficient manpower, the graduate diploma in palliative medicine will be launched next month to train medical professionals.
The demand is going to grow faster. The supply part of it is, do we have enough doctors? Do we have enough nurses? Do we have enough medical social workers? And that's really the problem. The second challenge, I think, is for doctors, for themselves to understand that this patient actually now needs palliative care. If patients are not referred in time for palliative care, sometimes it's too rushed for the services to which they are referred to look after them.
There will also be a new set of industry guidelines to share good practices in areas such as palliative care, as well as family and caregiver support.